Goodman, and this is Get Healthy, Be Happy. I'm at the Allende Center for Regenerative Medicine and Vitality, and with me is Dr. Diego Allende. Thank you for having me back. I'm so excited about this because you have so much to offer. Not only are you a great primary care physician, you offer concierge services here. Can you tell us a little bit about some of those services that you offer?
Sure. Well, thank you for having me back on your show.
My pleasure.
It's my pleasure to be here. And and I'm going to tell you a little bit about some items that we offer at the center. And sometimes patients aren't really sure what they are interested in or maybe have questions. So we provide somewhat of a menu sometimes for them to pick and ask questions at least from. And so at our particular center we offer a lot of different varieties of treatments. This particular one's offering these particular ones, and one of them is IV vitamins. And people ask me, well, doctor, why would I want to take IV vitamins or intravenous vitamins? And that can be for various reasons, but most of the time people want to take them for a boost, whether of energy or supplementation. They may have gut absorption problems or just deficiencies that they want to get replenished immediately. Because usually even on a good day, your gut probably absorbs about 40% of the nutrients put into it. Mm-hmm. And so giving a patient a very highly concentrated product in the intravenous form is bioavailable immediately. So there's no guessing whether it's going to be absorbed or not because it goes directly into the bloodstream. And if you look at vitamin D deficiency or insufficiency for one as a separate entity of itself, there is a direct relationship with how high yours is to your likelihood of developing any type of viral infection of any kind, including COVID-19.
Really?
A direct relationship, because they do long-term studies, longitudinal studies on certain populations. Like there's one done, there's been a longitudinal study on people of Irish descent because they don't have a lot of sun exposure.
And white like me.
They're very fair.
And I live in California, but anyway.
But they're unable to absorb and make enough vitamin D, and so they're deficient. And they've shown that if you just were to double somebody who's insufficient, say they're at 25 on their readings, if you doubled it to 50, their likelihood of developing a viral infection, of any kind, upper respiratory, is reduced fourfold.
Wow.
And so and people ask, well, how's that possible? Because vitamin D is a specific hormone, even they call it vitamin, that affects all your cells. It has a receptor on every cell of your body for it to tell it what to do inside. And it has a huge role in our immunity function and prevention of cancer. So that's how it works. So when they tell you vitamins don't do anything for you and have no role in medicine, the world has changed because we're a little smarter now. And we understand physiology and metabolic nutrition, how important it is, and why we suffer from conditions long term because of the deficiencies that we have. I know I talked a lot about that, so sorry.
That's going to make me go home and take more vitamin D through the wintertime. That really, you saved me, because when I first came to you, I was vitamin D deficient, very much so, and then started taking that Kforce, which has the D in it.
That's right, with the vitamin K.
And it took me right up to more than I even needed to be, but that's okay.
And that's okay, and Kforce is a proprietary name for a product, for a company that makes it specifically. So I'm not trying to promote any company in particular, but when you have a company that makes you a good product that's very bioavailable, well, it makes a difference because you're spending your money on stuff that doesn't work because it's got a name and you think it's good, but you don't know if it's bioavailable or not. And you got what kind of fillers they're using for it, and can they break through the cellulose capsule that's encased in. So sometimes going online and checking the information on the background of the product, or using a company, when I say medical grade nutrition, they can provide you a proof of purity for their product and its bioavailability. And those are key things. And so I use that particular product because they're able to give me that information if I call them. But the reason you take vitamin D3 with your vitamin K, and that's vitamin K2, which is menaquinone, is because when you take vitamin D3 in your intestinal tract and it's absorbed, it pulls calcium in with it. And that's how you retain calcium in your body. Not so much by taking calcium pills, but taking your vitamin D3 to pull it out of all the food you eat, because you eat a lot of calcium throughout the day, you just don't extract it. Mm-hmm. So if you take your vitamin D3, you take your calcium, now what? Well, if you don't have enough vitamin K2, also known as menaquinone, your body doesn't know where to put that calcium. Specific protein that gets carboxylated means it gets activated, comes and grabs vitamin calcium and takes it and puts it in your bone where it should be. Because your bone is the resource of calcium. And if you don't have enough vitamin K2, well, guess what happens? The calcium floats around until it finds a nice place to land, like maybe an artery or a plaque, and you get that calcium formation outside your body in places it should not be. So that's why you take it with K2, and that's why K2 is important, but K2 is also important for coagulation processes and making sure you're able to, stop bleeding by clotting. So again, another important factor, it is a fat-soluble vitamin, as is vitamin D, but a very critical, important role in lives of humans. And so that's why that particular product, but it's a fantastic product, and yours is therapeutic now. And I think that as long as you take your K2, you stay healthy all the time. You're not going to have a problem with vitamin D3 being a problem because it can show increased levels of calcium, because it's not. It's going to be in your bone. The only time you get elevated calcium is because your parathyroid gland is telling you to release more calcium. And that's because you either need it or because you're deficient, because you have low in vitamin D3, or you got a little tumor and they're called an adenoma, but those are usually not pathologic and they're not malignant. It's just that they're a problem because if you have elevated calcium, then you run the risk of getting increased risk of heart disease and things like that. Because again, calcium's floating around, not knowing where to go.
Interesting.
I know I got off another tangent there, but a lot
No,
of
but
information,
that's-
everything you say with nutrition, there's a reason why I gave it to you, and there's a reason why, and I'm thinking in my head, but I don't always go through the full process of explaining every single detail to you, although we'd all like to have an hour and a half with our patient telling them exactly why they're taking stuff,
Mhm.
but to understand the physiology and how it works takes a bit of time, right, for everything you do.
Wow. Now, I want to ask about this plasma facelift.
Yeah, that's my favorite.
Really?
Yeah, that's
Tell
my
me about
favorite.
it.
So let me tell you about a plasma facelift. In some other societies, they call it a vampire lift, but in the different world that I come in, we call it a plasma lift. And because that's a proprietary name, and we don't do that, I do a plasma lift. And it's real simple. So your body has lots of growth factors, and usually encased inside the platelets. That's the reservoir. So when you have a damage to your skin, like a cut or something, so you get a platelet plug, it stops bleeding, and then the healing process begins, because all your plates are releasing growth factors to get all these fibroblasts and other cells to come in and repair the damaged area and heal it for you. And that's how it works. And so a plasma lift works by us taking a considerable amount of blood from your arm, and say we take about 4 to 8 tubes of blood, depending on how much we're going to need, and we take that blood and we separate the serum out into the platelet-rich form from all the red blood cells and all the other stuff that's in there. So we have the platelet-rich plasma, and then we have the concentrated blood. So it separates out. There's the yellowish, kind of whitish looking, which has all the platelets floating around, and then you get a little buffy coat, which you get some white blood cells and some platelets, and then you have all the red, because they're more denser, so they go to the bottom when you spin it down. So we take that top layer off with a little buffy coat, we call it, and then we go and maybe concentrate it one more time. I usually like to concentrate it twice because I get a lot of product that way. And then what we do after that, we spin it up, and we stick it inside the photolight, in a photolight system called an Adalite. And different frequencies of light will cause bursting of the platelets and will release the growth factors. So in that fashion, we take it out, after we release all the growth factors, I go back and then I inject that. Well, what I do is I roll your face with a microneedling, which we call a aerating device. So we
Kind of like the lawn.
yeah.
Poke little holes.
Right, and so that causes some
Okay.
damage too, so you get some platelets there, so they come and release them, but then we're giving you an abundance of more growth factors from the blood that we took from you.
Okay.
So put that all over your face, put that on your neck, and if you got an acne problem, or if you got an abscess, or you got some kind of chronic skin problem, I can almost guarantee that in 3-4 days your problem is like almost gone.
Really?
And the downtime's like a day and a half, because when you're bleeding at first and you look a little beat up from the microneedling device,
Uh-huh.
but then you put the growth factors on your face, and then you kind of leave that on for like an hour or two so it soaks in there really well, and then you go rinse it off at home, and then within 2 days you see just an amazing glow to your skin, and that usually lasts for several months, maybe longer. It just depends. The younger you are, the longer it lasts. The older you are, the more often you have to repeat it. But if you repeat the treatments, probably once a month for like 2-3 months, you can see a significant change in your texture. And I would beg to differ. You see probably about a 5 to 7 year difference in skin texture quality.
Really?
Yeah, tightens the skin, rejuvenates, improves the glow. So this is a really hot product. It takes about, if you take your blood and we process it, it takes about an hour, and then we do let your skin numb on your face so it doesn't hurt very bad when we do that. When we do the hydrate, when we do the microneedling.
Okay.
And then it probably takes about 20 minutes to deliver all the information and all the product and just rub it in there.
I'll think about it.
Yeah, I know. It's not for the faint of heart.
I do. I love the idea, but it's sounds very interesting.
Like I said, we numb you good.
Yeah. Okay. Now I'm familiar with Botox. Most people are.
Yeah.
Okay. Collagen fillers for facial enhancement.
Right. So we use collagen fillers, but they're usually a hyaluronic acid-based product.
Okay.
You can actually get collagen too. Hyaluronic acid is a basement membrane product of collagen, so it helps you make more collagen if you provide it. And so we use the hyaluronic acid fillers, and we can use it for the tear trough, like for instance here underneath the portion of the eye right here, this is the tear trough. We can fill them in so they don't look so gaunt there. We can increase the bulk, basically the cheek area, and on the lateral side, the diagonal side, where people really like to have a nice sharp appearance, where it's crisp, and we can actually enhance that as well. So we can do that for there, we can do that for the nasolabial folds here, we can do that for the lips, we can do that for the pre-jaw lines here, because this people get a little gaunt here, so we fill them out and bring it down a little bit. If you have a little cleft disorder, we can enhance that and bring it out so it appears to be more elongated, but it elongates the face, but also looks like a thinner face, which is a more well-formed cheek or chin bone. And then we can also do nose jobs with it, believe it or not. We can texture nose, yeah. So if somebody has a curvature on the nose they don't like, we can actually go subcutaneously and inject on the nasal bone shaft all the way down, and we can increase the amount to increase the size of that portion, and then we can sharpen it by injecting that too. We can actually improve it. You can actually improve the jawline too by bulking it posteriorly here, and then elongating chin, as I said previously. So you can actually improve a lot of features that you normally would not think you could. It just takes time. It takes an artistic approach to it, so you have to take your time with it. And sometimes it does take several syringes to get the ideal response, but ultimately it's what you're looking for, because if you do it the right way, the product's going to last in there around a year, maybe longer.
I was going to ask how long.
And the more often you use these products, the more likely you are to create more collagen over time, so it actually will stay longer over time. So it's not uncommon to do like some cheekbones, or say we do some lip enhancements on patients, and maybe they come back after 8 months and they do it again. It's not common for them to come back for like another year or maybe 14 months the next time, and then after that maybe a year and a half, because they make a little more. And it's just some patients get used to having that nice fullness, and they start to go down a little bit, and they will want it filled already again. But the reality is the product lasts a long time after you start to train the patient and get them exposed to hyaluronic acid, making more collagen and enhancing that look already that they have.
Yeah. I've got what I call a bony face. I've got the high cheekbones and a prominent orbital ridge. My dad was half Native American. So, mine would be like, give me some fat in the cheeks.
Well, and that's, you just bulk it up, like you said. You
Yeah.
bulk it up there, and you fill it in. It just take a considerable amount of product sometimes to get what we're looking for, and we have to, kind of shape it as how we want it to look like. But effort has to be put into it to get what you're looking for.
Oh, yeah.
Yeah, so but it's fun to do, it's projects. They're good stuff to do it.
Definitely something you think about down the road. Okay, nitric oxide.
So let me tell you about the nitric oxide cream. It's
Yeah.
actually a serum. So there's very few products on the market now that help make or mimic nitric oxide production. There's some capsules out there, and then there's all natural stuff like the beets and the pure beets and the powders and stuff like that help increase nitric oxide production. But there's actually serums that you can put on your face. And the reason why you would do that is because nitric oxide is one of the strongest antioxidants your body makes. It also increases blood flow. And so when you put the serum on your face, it helps regenerate, it helps stop tissue damage, it helps increase blood flow to the area. So it is a natural antioxidant repairing, basically, product that you can put on your body, scars, your face, and use it on a regular basis. There's only one company making this particular product right here, right now. They got a patent on it, but it works remarkably well.
I wanted to ask you about, you have, and I don't know the proper name for it, I call it the red light bed.
Yep.
Infrared, and what is that for? What does it do?
Well, it's an infrared red light therapy bed, but it also has a blue light too. And there's several treatments that you actually can get out of this particular device. Having a high-powered energy device is super important because that depends on how much the light penetrates your body. Okay, infrared light, 40% of the sunlight that we get is infrared. A lot of it's blocked for different reasons that comes out, so to get enough infrared light treatment, or I guess exposure, you have to be outside in the sunlight during prime time. And people say, well, that's bad because you increase your risk of cancer, but you're not supposed to be out there more than like 15, 20 minutes, but it's actually healthy for us. Infrared light has one particular wavelength that goes deep. It goes deep into the tissue, about 8 centimeters through your skull, okay? And what it does, it provides photon energy, direct energy. So you know how plants do photosynthesis to create energy? Well, humans can get energy production through glucose to make ATP, or you get it through infrared light to do photon energy. So you can create energy that way. And that has some beneficial effects in treatments of conditions like dementia and cognitive decay. Yeah, so great stuff. It also helps with detoxification. It helps with pain. All kinds of great stuff. So infrared can travel much deeper, but it provides different various treatments as opposed to red light. Red light, interestingly enough, helps you make more nitric oxide. So red light can help you produce more nitric oxide, which increases blood flow, which will increase texture of your skin. So you can lay in the bed and get a whole body treatment, as opposed to doing just a serum for your face. But you know, there's a huge difference between using a serum, a little bit of serum, versus a whole body treatment of an infrared or red light therapy. But red light therapy will provide increased oxygenation and blood flow. And so it does improve the texture because of nitric oxide production. It helps stop oxidant damage, providing antioxidant treatment. So that's what those particular treatments do. The blue lights for patients who suffer from chronic acne problems. So blue light is a different wavelength than the 400, so that actually damages and kills bacteria that causes acne. So you can see a significant treatment or change in condition following multiple treatments of that. And so it's not common for a patient to use a red light, blue light, and infrared light combination treatment. So there's different settings on the machine that says relaxation or pain relief or anti-aging treatment. So the machine actually, you can program what kind of treatment you want, and that program determines how much of red light or how much infrared or how much of blue light you're going to get in the pulsations. So maybe 2.5 minutes of this, 5 minutes of this, 2.5 of this, so you can give multiple treatments and overlap the treatments.
So each patient, is it a different time setting? Like maybe this patient needs 20 minutes and that patient needs 30 minutes, or how does it work?
Well, it's pre-programmed. So
Okay.
say if it's chronic pain or pain treatment, then it's preset for like 22 minutes, let's say.
Okay.
And so the treatment will be 22 minutes of alternating red light and some infrared light, because they both have benefits, and you're increasing blood flow, detoxifying and neutralizing pain, right, and providing deep energy to help heal. So alternating treatment, so there's benefits of both of them. So the machine will alternate. If there's one for relaxation, which may increase the infrared, or may increase the red light therapy, decrease the other one. If you have a condition for acne, then it's going to give you more blue light or just all blue light. So, and it's a preset program treatment based upon years of research and studies. And so you buy the light therapy bed that already has a pre-programmed settings for those particular treatments based on the research that they've done over time.
Interesting. Years ago, there was a plastic surgeon here in town that had this bubble tub. I forgot what it was called.
I know you're talking about the nano tub, or
Yeah,
yes.
I tried it a couple times. I couldn't tell you if it did anything for me or not, but it was kind of nice when I was laying in it. But I just assumed go get in a hot tub somewhere.
You get the same gratification. Yeah, I'm not sure how much information. I only stick to the stuff that I kind of know about. So it's kind of hard for me to comment on what somebody else do. But I imagine there was probably some good research or some particular focus research. It's just hard to sometimes get your product across to people unless you spend a lot of time advertising yourself or pushing that product. And that was his niche. And like For me, I have these other treatments that I think are fantastic, and they're insta treatment. And if you suffer from chronic pain, let me just tell you that infrared red light therapy bed, what a difference that makes. It's just not going to happen overnight. It's going to take months, but you're going to slowly have improvement in your condition. Pain, energy, it's just amazing. Skin texture, quality.
You're piquing my interest in that.
Right.
Well, I always was. There's something about it. It's like, it kind of looks like a tanning bed, but better.
Yeah, that's exactly it. But like I said, you can't expect this miraculous treatment. Like if you want a miraculous treatment, let's do a plasma lift. Let's do erbium resurfacing, because erbium resurfacing is it has more downtime, but in essence we're doing kind of what plasma does, except not giving you growth factors. We're just damaging the dermis so bad that it sloughs off, and then all the new cells to create the new epidermis have to come from the dermis, and so you're going to get brand new, healthy, immature cells that need to come in, and so your skin's going to look fantastic. And unfortunately, there's like 8 to 10 days of downtime. You really look beat up, but I like the treatment. It just depends what a patient wants, and sometimes people don't want to have needles in their faces, and I don't blame them. It just depends what you want to do.
Now, I saw a poster out in your lobby for something called Livion.
Yeah, so that's one of the companies that I've used in the past, and I use from time to time to provide me umbilical cord stem cells or umbilical cord blood for acellular products that we use. Remember I told you we have platelets, we get all the growth factors out of
Right.
it? Well, you can actually buy some of that stuff with no cells in it, but just have lots of growth factors. So we can use those products to get them from umbilical cord blood, because they're normal newborn babies. There's nothing wrong with them. They just salvage the cord and able to get some of the amniotic tissue out of there, and they're able to get acellular product, which means there's no cells that are alive, and get the growth factors and the collagens and the proteins and things that we need, hyaluronic acid. But then there is products where you actually can get cells too, and sometimes you use those for different things like joint injections, damaged tissue. And it's not so much that those cells take, because genetically they're different from the host, and so they don't typically take. But what they do is stimulate your own stem cells and your own healing factors. And because they're very young, immature cells, they're like running hot. They're running hot. And it's different from being like my age. I got a 51-year-old cell saying, okay, I'm brand new, but I got a low, I'm on more show than go, as opposed to the really young and mature ones, and they're like ready to go, and they're just nonstop, and it can produce a lot of healing potential. And so, and that's the whole point. They provide these trophic changes, these healing changes in growth and repair. And so we use those products for, like, if you use stem cells, we can use them for joint repair, healing tissues that are damaged, ligaments, tendons, cartilage, or reduce pain. Just depends. We can use them for shoulders and things like that. We can use them for skin damage, for wound care. So we're able to use different products that they're able to provide for us, and usually depends on the type of injury that they have. We're looking for repair, but there's also a cost difference associated with just getting growth factors and or getting the stem cells, the umbilical cord ones. But overall, they provide an anti-aging regenerative process that's considered trophic, because all the changes it causes over time. So it houses them over time, so it affects over time. It doesn't just stop over a day or a few days. It goes on for a long period of time. It could be several weeks to months, and that's where you see the long-term benefits. So it just depends on your financial position to utilize those products. But if you're going to use a lot of these treatments, they're in the same realm of cost-wise, but they're very good. When I approach a patient, or when a patient comes to me and consults me about potential different types of treatments, it's an individualized treatment. I don't know what I want to do for that patient until they tell me what they're looking for, and then I do the assessment, which is the exam, and see what's in their best interest, whether they're going to get the best result, or what their level of tolerance for what kind of treatment we're going to perform. Medicine has always been put into one size fits all, but that's never been the case, because humans are genetically different, and we want different things, and our perceptions are different, and our tolerances are different. So you have to take the time to talk to the patient, or rather just listen.
I want to commend you on your office staff. They've always been very polite and very professional, And I've had experiences in the past at other doctors' offices where they weren't. So I really appreciate that because they're your front line.
Yeah.
You know, you can have a wonderful doctor, but if you've got an office staff that's offending patients, eventually you'll lose them, because I have left other doctors' offices because of their staff. So have most of them been with you for a while?
You know, some of them have been with me for a long time. Unfortunately, because what's going on now with the pandemic, you've had some turnover, not because it's been on purpose, just because of timing. I've had a couple patients a couple employees go out on maternity leave, and unfortunately, they're not able to come back to work because they're unable to get daycare services.
Right.
So it's kind of like this thing that we've had a little bit of turnover, but all my employees usually have been here for at least over 5 years or longer. I don't like to lose employees. I'm actually like to employ rather than unemploy people. So I try to keep them because it takes a long time to train people to do what we do,
Right.
and to answer questions. So I appreciate saying that about the employees. I think it's important to have good employees and people that represent you well, and it's nice to hear nice things about them because it reassures you that I'm doing something maybe that might be making a difference. Because they're the first piece that people see when they come in the door, and the last one they see on their way out.
That's true. And you know, they handle us sometimes at our worst. We're in pain, we're sick, we're scared, you know, whatever. And I've actually kind of gotten a kick out of Lily a few times. She's always so pleasant. I know that I've posed some really strange questions at times, like, do I really have to do this? Yes, you really have to do that. So, has she been here the longest, or?
Yeah, at this point, yeah, she's been here the longest. Like I said, I had a few people that were internally that just can't come back yet, and so I'm kind of hoping that they get to come back, but there's no end in sight in that right now. So, but right now she is the longest standing employee for sure. She's been over here for like 6 years one time, and she's going to get her pre-nursing done.
Good.
I'm going to go to nursing school because I push her. I want her to do better. I want her to go and get those skills because I want her to come back and hopefully stay with me because she's an asset to the practice. And I would like all the employees to seek further education because I want them to do better and have high aspirations and know that they can succeed and educate themselves and do stuff they never thought they could do, but maybe they might be the first one to do it in their family. But that's a great accomplishment. And so I think that, I'm hoping that, that continues on and she comes back and stays with me because I think she's got a long future with me if she wants to.